the difference when I think about what we were seeing in our patient population a year ago to compare it to this year. These patients are much sicker.
It has rapidly increased the percentage of women we're seeing in pregnancy who are getting sick and being referred to tertiary centers like ours.
We're having more patients and with bad outcomes.
We have had far greater numbers of ICU admissions and far greater numbers of women on ventilatory support.
More preterm births.
When you're talking about preterm birth, it depends about what gestation. So you could talk about a kid that spends months in our nursery. We could talk about kids that have permanent lung issues, that have blindness, or that don't survive their preterm birth.
COVID is worse than vaccination, point blank. I just cannot strongly urge vaccination enough. It's not safer to wait. The answer is yes. The vaccines for COVID-19 are considered safe in pregnancy. Further, both pregnant women and women who are trying to conceive fall into a category of high risk for complication from COVID-19 infection. We strongly recommend and encourage vaccination. Pregnancy is an indication, not an exemption.
We have no documented evidence of any major risks to babies from receiving the vaccine. I will state that Dr. Streitman probably can attest to this, that if you get COVID and you actually become severely ill, that is much more of a risk to your baby. Potentially preterm birth as a result of that is much more of a realistic concern.
We know that the vaccine response in our bodies, pregnant or not, consists of two major types of antibodies that we develop. One is called IgG and the other one's called IgM. The distinction is important because IgM antibodies naturally do not go through the placenta and don't protect the baby in any way, shape, or form. However, IgG antibodies readily cross the placenta, and we actually take advantage of that fact with other vaccinations during pregnancy, such as the Tdap vaccination to protect the newborn baby against pertussis, whooping cough. The antibody response duration is months, and so if you get the vaccine in the first trimester or second trimester, you're going to be producing that IgG antibody that's so important to pass through the baby, through the placenta, into its bloodstream directly. You're going to be passing that throughout the remainder of the pregnancy, and the baby will be born with that and hold on to that for at least 3 months after the birth, if not longer.
Yes, the vaccine is safe while you're breastfeeding. You and your baby will not get COVID from the vaccine. And we're only seeing passage of antibodies through the breast milk to the baby.
Because we've had multiple studies now showing the observational data that the vaccine does not cause birth defects, and because we have anecdotal and studies that show COVID infection in the first trimester can lead to miscarriage, I would encourage you to become vaccinated as soon as you can. Again, either before pregnancy or in that first trimester.
It will kick in quickly within a month and a half, and the antibodies, as soon as you're making them, will go through the placenta. They don't wait. So they'll go through the placenta, and the baby will carry those through the rest of the pregnancy and for about 3 to 6 months after the birth.